Webinar Wednesday will be starting in about 10 minutes. Good afternoon, everyone. We're going to get started. Hi, everyone. Welcome to Webinar Wednesday. I am your host, Kia, and I want to thank you for joining us. Today's speaker is Dr. Burkhead. He is going to cover how to reduce your risk for breast cancer. For some more information about our doctor, he is board certified by the American College Board of Obstetrician and Gynecology. He currently practices at the Women's Center and downtown at the shops and sometimes at the Ambulatory Surgery Center at main campus. And he has been with Kelsey since February of 1999. As a reminder, we will be taking any questions you have at the end of the presentation. If any question happens to pop up in your mind, just go ahead and type it in your questions box, and we'll do our best to address it at the end of the presentation. With that being said, I will now hand everything over to Dr. Burkhead.
Good afternoon, everyone. This is Dr. Burkhead. I'd like to thank Kia for that introduction. Hopefully we won't have any more technical glitches here today. Anyway, what we're going to talk about today is ways to decrease your risk of breast cancer, not specifically any treatments or advanced therapies or specific surgeries or anything of that nature, but we're going to talk about ways to make an impact to reducing your risk of breast cancer occurring in your life. And so to get started on this, the first thing we're going to look at is just to understand the important components of the female reproductive system. And the breast consists of both fibroglandular tissue, which would be the milk lobules here, the milk lobules where milk is produced during lactation or during breastfeeding, and also the little ducts that carry the milk out to the nipple here, which is the nipple right here. So you can see that you have the ribs here, you have muscle here, and then you have fat tissue that surrounds the actual glandular component of the breast. And then there's also supporting tissue like ligaments that support the breast tissue. And it's important to understand that breast cancer is the second most common cancer and cause of cancer death in women. Of course, the number one cancer is skin cancer. And that a lot of folks don't think about that, but that's very important because of all the sun exposure that people have in North America. And of course, the number one death rate is lung cancer. And of course, the modifiable risk factor for lung cancer, of course, is to stop smoking, because virtually unilaterally, people that have lung cancer are smokers or have a very long history of smoking. And of course, to look at the scope of the disease, about 250,000 or 250,000 cases of invasive breast cancer are expected to be diagnosed in men and women as of 2017. And that number is pretty consistently in that 250,000 range. And about 40,000 women are expected to die from breast cancer. And there has been a decrease in death rate since 1989, and that's of course due to more advanced therapies that are available that weren't available 30 years ago. And then of course, this number of 12.4%, 1 in 8 U.S. women will develop invasive breast cancer over the course of their lifetime. That, of course, is looking at their entire life. That does not mean 1 in 8 by the time women are 50 or 60. Of course, it's an age-related phenomenon, and typically breast cancer occurs as women get much older. Now, breast cancer in men is important to understand that it does occur. It's about 100 times more common in women than men. But unfortunately, because men don't think about breast cancer and they don't think that they can get it, or don't realize if they have a lump in their breast, or if they have some leakage from a nipple, or if they have some mass in another part of their chest, on their chest wall or in their armpit, that it could be a cancer. And typically men don't live as long with breast cancer as women because they go undiagnosed for a longer period of time. So anytime a man has any type of change in his nipples or his chest wall, or anything that's a change, a lump, nipple secretions, bleeding from the nipple, especially a mass underneath the nipple, those are things that need to be brought to the attention of their primary care physician as soon as possible. And of course, another important factor about this would be the family history. So if there was a very strong family history of breast cancer, and for a man, that would be an increased risk for him having breast cancer. So there are about over 3,000 cases of breast cancer diagnosed every year in men. As far as risk factors for breast cancer, obviously the biggest risk is being female. And of course, as I alluded to earlier, it is an older woman's disease. Typically, the big jump in breast cancer begins when a woman gets into the 40s and moves into her 50s. There's also another aspect, beginning menstrual periods at a very early age, going through menopause at a much later age. And this concept here is that women, the idea is they are exposed to estrogen for a longer period of time because they go through begin to have periods at an early age. So there's more opportunity for the breast to be exposed to estrogen for a longer period of time. Also, white women are more common as opposed to other races, although all races are well represented with breast cancer. People who have a personal history of breast cancer, in the past, or precancerous breast lesions, that's another risk factor for breast cancer. Thickening of the breast tissue or increased density that's noted on mammography can also increase your risk. And of course, a family history of breast or ovarian cancer is important. And then finally, the genetic mutations. There are many genetic mutations that are not known about currently that I'm sure we'll discover in the future. The most common that are well known now are the BRCA1 or BRCA2, we refer to as BRCA1 or BRCA2. And these are mutations at the genetic microscopic level that are in a person's body from the time they're born, and it increases the risk, and it's a significant risk. So there's really 7 steps to look at reducing your overall lifetime risk of breast cancer. First of all, to know your family history if possible, to minimize radiation exposure, and this would of course be important for any woman that's had radiation exposure to the chest, say for lymphoma when they were younger or even at any time in their life. Limiting hormone exposure as women get older, especially in the postmenopause years. Pregnancy and breastfeeding actually can help be protective. In other words, decreasing your risk by more time breastfeeding and more time being pregnant. Importance of not smoking and reducing alcohol intake, and avoiding an elevated body mass index, or avoiding being obese. That can actually decrease your risk as well. And of course, a very important bonus tip would be to get screened. And that's important because for several reasons. Number one, we talk about the ways to do that would be to have a monthly self-breast examination by the patient themselves. And then secondly, to have an annual physical exam at the very minimum, an annual physical exam with the physician. And then of course, depending upon your age and your risks and your family and your personal history, would be to have imaging studies such as mammography done at an appropriate time. Now, as far as your family history, about 5 to 10% of breast cancer is hereditary. So it's due to a variety of mutated genes. We talked about the BRCA1 and 2. These statistics are very, very, very important to understand, because if a person has a very strong family history of breast cancer and decides to get tested for these genes, which is a blood test, if the BRCA1 or 2 comes back positive, you can see here that your lifetime risk, instead of being roughly 12% to 13%, skyrockets to 55 to 65% for BRCA1, and your lifetime risk for BRCA2 of acquiring breast cancer is about 45%. So these are very significant numbers. And so if a person has a very strong family history, or if they know someone in their family that has the BRCA1 or 2 gene, they should certainly consider seeking treatment, seeking diagnosis to see if they carry one or both of those genes. And of course, it's important to understand that it's both the paternal or the father's side of the family as well as the mother's side of the family for history of breast cancer. So just because someone on the mother's side of the family had no breast cancer, if there was a very strong family history on the father's side, that would be something to consider and the diagnostic discussion with the physician for when to start screening for breast cancer. And also, it's important to think about a family's history of other kinds of cancer. In other words, especially people whose family members have multiple different types of cancer. There are certain syndromes where the breast cancer is only one of a spectrum of many diseases that run together, so to speak. And so if a person has, of course, we mentioned earlier about ovarian cancer, it's important to consider breast cancer diagnosis or breast cancer screening at an earlier age, perhaps, if a person has a history of ovarian cancer themselves, or if there's a very strong history of ovarian cancer. And of course, other types of cancer such as colon or cancer of the lining of the uterus, what we term endometrial cancer, those can also be associated with an increased risk of breast cancer. We talked earlier about women who had radiation exposure to their chest area for previous cancers such as lymphoma. And lymphomas are typically diagnosed in much younger people. And of course, if you have that chest radiation exposure, either a man or a woman, there's an increased risk of developing breast cancer. And if the radiation was given during the time when the breast tissue is still developing rapidly, during say adolescence, before the 20s, typically that's the time when the radiation has the greatest negative impact for the future. Now, as far as hormone exposure, this has been a very controversial topic, but in general, the thought about increasing risk of breast cancer is more concerning for women that use hormone replacement therapy after the time they go through menopause. So the time of exposure to estrogen after menopause typically will increase the risk of breast cancer by 2.3% per year. And then if you use the estrogen for a short time, say 1 or 2 or 3 or 4 or even maybe 5 years, the risk is less than if you prolong that for a duration of greater than 4 to 5 years. And also, a lot of people have questions about birth control pills, and there have been some very large studies that have looked at the association between birth control pills and the risk of breast cancer. And by and large, those studies show a very, very small risk, if any. There are some studies that have shown an increased risk compared to women who have never used birth control pills when they compare it to women who have used the pill. And after 5 to 10 years, there's a decreased risk, and after 10 years, the risk normalizes. But the most important thing to realize is that there's no strong or compelling data that women should avoid birth control pills during their reproductive years, but to realize that there may be a slight increased risk of cancer as a woman ages. Another modifiable risk factor would be women who have had no children or had their first child after the age of 30 have a slightly higher risk of breast cancer. Breastfeeding has been linked to decreased incidence of breast cancer, and for every 12 months of breastfeeding, there was actually around a 4.5% reduction in the relative risk of breast cancer. And this has to do with the fact that when you're breastfeeding, that there's a decreased amount of estrogen in your body, and so the thought is that there's probably, because of decreased blood levels of estrogen affecting the breast, that is probably providing this relative decrease in breast cancer risk. Another risk factor that can be modified, of course, would be to stop smoking. And of course, the most important aspect of this would be to decrease your risk of cancer of the lung as well as cardiovascular disease, which are by far and away the most serious risks of smoking. But of course, if you start smoking at an early age or before the first birth of a child, the smoking was associated with an increased risk of breast cancer, suggesting that smoking may have a role in breast cancer initiation. In other words, it may start some events microscopically that could start even decades before breast cancer would otherwise develop. So if someone stopped smoking at an early age or never started smoking, they're probably in a much better situation than if they had smoked long term. Another risk factor that can be modified is the reduction in alcohol intake, because it's been shown the more alcohol you drink, the greater your risk of developing cancer of the breast. Those who have 2 to 5 drinks daily have about 1.5 times the risk of women who don't drink alcohol. So, of course, you also have to understand that and think about 2 to 5 drinks per day is a pretty significant amount of alcohol intake, and there are other health ramifications as well. Blood pressure, weight, effects on the liver, things that can be very, very serious. So in terms of decreasing alcohol intake, if you're drinking 2 to 5 drinks per day, in addition to the other health concerns, it does increase your risk of breast cancer. And basically, alcohol can increase the levels of estrogen and other hormones associated with hormone receptive positive breast cancers. And it can also increase the breast cancer risk by, at a microscopic level inside the cells, damaging the DNA. And when the DNA is damaged, then it can cause those cells to mutate and be more likely to turn into malignant or cancerous cells in the breast. And another modifiable risk factor would be avoiding obesity. Body mass index is calculated as weight divided by meter squared body surface area, and consistently has been associated with higher risks of breast cancer in women who are postmenopausal. And in this very large nurses' health study, which was performed several years ago, women who gained 10 kilograms, or that'd be roughly about 25 pounds or more since menopause, had a higher risk of breast cancer compared with women who maintained their pre-menopausal weight. And we believe that this increased levels of estrogen because of increased amount of fatty tissue and insulin is what leads to the change in the cells that can lead those cells to become malignant and cause breast cancer. Another risk factor, or another way to modify risks, is to get moving. Basically to take an opportunity to engage in regular exercise. And they found that the people who walked briskly, even for a short amount of time, for 1.25 to 2.5 hours per week, had about an 18% less risk of breast cancer than women who were inactive. So it's significant that even brisk, healthy exercise can reduce your risk significantly. And estrogen is believed, the reason is it lowers estrogen levels, probably by lowering the amount of fat cells, and then estrogen stimulates overgrowth and breast cancer in women that don't exercise regularly. Also, nutritional aspects are important to have a lowered fat intake and decreased red meat intake. And then carotenoids, which are substances that are found in fruits and vegetables such as corn, egg yolk, sweet potatoes, carrots, and leafy vegetables, are help to be protective for breast cancer. And women who consume more of these had an even lower risk of developing estrogen receptor negative breast cancer, which is often more aggressive. That's often termed like triple negative breast cancer. So women who consume these particular products had a decreased risk of developing these really aggressive estrogen negative cancer, estrogen receptor negative cancers. And then among Asian women, a higher intake of isoflavones found in soy of greater than 20 milligrams per day was associated with about a 1/3 reduction in risk of breast cancer, 29%. So again, not an insignificant reduction. As far as, and I talked about this earlier, as far as kind of the bonus tip of the day to get screened, it's the most important, because what mammography is designed to do is to find lesions before they are able to be felt by either the physician or healthcare provider or the patient. But it's important for several steps for as far as screening would be to screen yourself, and that would be with a monthly self-breast examination, which I would encourage you to talk to your primary care or your OBGYN or whoever you see for your annual physical exam to go over the self-breast examination and how to perform that. And that should be performed at least monthly. And then, of course, a clinical breast exam by a healthcare professional at least on an annual basis, at which time they can review your history and they can also calculate your risk based upon these risk factors that we've talked about today, as well as personal history and family history. And of course, imaging it really falls into really mainly 4 categories. The most well-known of which would be mammogram and ultrasound. Mammogram is usually the starting point at which most women start by receiving a mammogram. At times, mammogram is supplemented by ultrasound, MRI, or PET scan. Typically, MRI or PET scan or PET scan are reserved for difficult cases where mammogram and ultrasound are either not able to really answer the question fully, or a person has a very serious family history of breast cancer, or maybe even a personal history of breast cancer in the past, and they may need to resort to more complicated means of imaging, which would be an MRI or a PET scan. And basically, and this is key, and this is why the self-breast exam, the annual exam by a doctor, and of course imaging is so important, because early detection is the key to survival. Because the 5-year survival rate for breast cancer that's found early and confined to the breast, in other words, it is not spread beyond the organ that it started in, is 99%, according to the American Cancer Society. So it's important that we find the earlier the invasive disease is found, the greater likelihood of someone having a long-term good outcome. One other aspect that's been in recent years has been discussed and brought up about breast cancer risk is having dense breasts. And there is some data that your breast cancer risk would be up to 4 to 5 times higher with having dense breast tissue. And when you have more tissue than fat in your breast, which is common in younger women, it makes cancer harder to detect on a mammogram. So if a person has very dense breast tissue with a lot of fibroglandular tissue, then it's more difficult to detect on the mammogram study. And that's when often the other techniques that I mentioned, the other imaging studies such as ultrasound, MRI, or PET scan are often used. And this would be an example of the variations in the composition of different breasts. This first on the top left here of these 4 images shows primarily fatty composition. B would be scattered fibroglandular composition, which would probably be the majority of younger women. And then of course you can see here mixed composition, which is becoming more and more dense because there are more of these areas that are highlighted here in sharper images in color, and not color, but in images with dense white notation. And then of course this is a very dense composition breast, so you can see that this density would make it hard to find small lesions that you would otherwise see in these areas of fatty tissue in the breast. So with that, I will conclude, and I would like to entertain any questions. I'd like to thank you for your time, and thank you, Kia, for your time for helping out with this. And if you have any questions, please don't hesitate to type them in right now, and we'll try to address those. Okay, I'm going to read the questions that I've received, and I'll try to go through these, and there's some really good questions here that people have indicated, and I hope we'll have time to go through them all. Does exposure to a mammogram radiation increase breast cancer risk? Very good question. Probably a few women per 100,000 over a period of years would increase their risk of breast cancer if they were to have mammograms every year. So we believe, based on the data, the increased risk of cancer is certainly outweighed by the benefit of having mammograms done on an annual basis after the age of 40, and certainly after the age of 45 to 50. The next question, does it differ, the difference between a 2D and 3D mammogram? We believe the 3D mammogram is superior because a 2D mammogram is a regular digital mammogram, and then a 3D mammogram is where they take very complex computer software and they model the breast in 3 dimensions. So they get a better image from the regular mammogram. They model it with some very complex computerized software, and they see the breast in 3 dimensions. So the 3D is probably better at picking up lesions than the 2D. So a lot of people are moving toward 3D mammogram now. Another question, I've noticed my breast hurts in a certain spot. Is that a concern? Anytime someone has a new onset of a symptom, whether that is a lump or a soreness or anything that persists beyond a few days, at most maybe a couple of weeks, that would be something to bring to the attention of your primary care physician or your OBGYN. Breast cancer is often painless, but that doesn't mean that it couldn't be painful at times. So if it hurts in a certain spot and it's persistent, I would certainly recommend that be evaluated promptly within, certainly I wouldn't let it go beyond a couple of weeks. Another question was, I know the person's asked, I know you mentioned BD pills increase your risk. How about having the Mirena IUD? Probably not. The Mirena is a progestin containing intrauterine device. This is the little device that fits inside your uterus that prevents pregnancy for 5 years. It's called Mirena. And the local effect of the progestin, or the hormone that's actually in the Mirena, is going to act locally on the lining of the uterus, which is going to remarkably decrease the risk of cancer of the lining of the uterus, because that's where the Mirena is placed. So that gives a tremendous benefit there. And there's probably little to no increased risk of breast cancer long-term with the use of Mirena. The next question is age to start screening. Different entities around the country have had different ages. Some have said 50, some have said 45. In general, the standard that most people adhere to is starting screening at the age of 40, and certainly earlier if a woman has a very strong family history of breast cancer, or she has a personal history of breast cancer in the past, it would obviously start earlier than age 40. Next question is relationship of breast implants to the diagnosis of breast cancer. To my knowledge, there's no compelling scientific data, and again, I'm not a breast medical oncologist, but the relationship of breast implants to diagnosis of breast cancer is there's probably no relationship between the implants. Typically, as I said, there are other risk factors that are probably present, and that the breast implants specifically probably did not contribute to that. The next question is, my mother was diagnosed with breast cancer